you through a walkthrough of the DPT, the functions, do a general demo, or we can do it, like I said at the beginning, if you have general questions, you say, hey, this is something I've been interested in my practice, would you be able to do that? I can do that approach as well. Or we could do both. I could do a quick demo and then we open it up at the end.
Sounds good. Okay.
You want to do that?
Yeah.
Okay, so I'll take about 15 minutes. I'll do a quick demo and then we're going to open it up for general, just back and forthing. All right, so DPT. When you first open the DPT, you're going to get a DPT dashboard. The DPT dashboard, this is a summary of all the patients that have been imported into the DPT. So for this demo version I'm showing you, you can see there are 13 sentinels, which is a sentinel in CPCSSN is just a physician, or not just a physician, it could also be a nurse practitioner, a physician assistant, depending on how you're how you set up, but a primary care provider. Okay, we have 22,000 patients. And then we have on the right here, it gives you another breakdown, but it compares all your patients to something we call YCG patients. YCG patients is a yearly contact group. So within CPCSSN, we say any patient that has a visit in the last 12 months. So if I was to look at this, it's saying we have 22,000 total patients in the system. However, only about 10,000 of those have been in the last year, and then the breakdown of those. Okay. Moving through the graphs on the dashboard, it gives you a gender distribution of your physicians, your patients, and then your yearly contact group patients. A condition proportion percentage based on those patients that have been in the last 12 months. It's telling you 11.5% have diabetes, so many have depression, hypertension. The reason why you're showing these 9 are these are the conditions where CPCSSN has developed a detailed case definition for. What that means is CPCSSN looks across the whole chart. It looks across the profile or the health condition table, the billings, the medications, the labs, the referrals, and then it builds a case definition to say, based on these identifiers, we can safely assume that this patient has diabetes. There is data in the database that can do other ones. However, these are the ones that CPCSSN has created the algorithms and validated those algorithms. Okay, so that's diabetes, depression, hypertension, COPD, osteoarthritis, dementia, Parkinson's, and epilepsy. And if anyone has questions throughout, just jump right in. I'm happy to stop as we go along. Okay.
I have one question.
Sure.
I'm wondering, all these data, they're not real-time data, right? They're just based on the last quarter that was posted?
Yeah, that's correct. CPCSSN does quarterly extractions, so you're always going to be at least 3 months back. Actually, I don't want to say always. Currently, the way CPCSSN works, it'll be 3 months back.
Okay, and when do you usually do the importing?
When do we do the importing? So it's a quarterly extraction. So if you were working with Lauren and had a DPT, you would get the extraction would happen quarterly, and then within a month after the extraction, you'd have your newest DPT.
Okay, is this like after the extraction, is there a notification for the CHCs knowing to notify them that this has happened, or?
Not right now. That would be a process that we work out with Lauren. So what one of the things too is this is a relatively new process for CPCSSN where we're getting more and more people involved in the or not involved, but more and more people access to a DPT. So we actually haven't formalized anything. So a lot of that would be helpful in your feedback to say, hey, this would be great, and working with them so we can establish future processes for future CHCs and other clinics. So
okay, thank you.
Yeah, so you're kind of the guinea pigs, if you're okay with that.
Just a question about your the gender distribution. Is that the gender of the providers that's there under Sentinel?
Yes, that's correct. So 38% of the providers are male and 62 are female. For this demo set, yeah. Okay. Any other ones? Or good?
It's Simone. We never? I know. I know, Dave. Before you presented at the retreat, because Dave presented at the retreat, I guess 10 days ago, we had asked Rachel whether there was any update on the issue you guys were having with the diabetes coding, and they didn't at the time. Have you heard anything else from CPCSSN about coding? I'm asking Somerset or Dave, whoever might have.
I haven't heard anything, Simon, about the issues with the identifying of diabetes and hypertension since that email with Rachel.
Oh, because that's where the numbers weren't corresponding with what was showing in your EMR. Is that correct? Is that the issue?
Yeah, it was a sort of a manual search of the EMR, and the numbers didn't correlate with what you guys had.
Yeah, I apologize. And when it comes to the data or the behind the scenes stuff, I'm not I'm not connected with that anymore. My role is purely with the DPT. Apologize.
We'll follow up. Maybe what I could just say is that in general, CPCSSN has a very high sensitivity and specificity. Not perfect, but very, very reasonable, and they've checked their algorithm against chart abstraction. So I'm hoping that whatever happened here for Somerset, is a one-time thing, maybe related to the fact that the EMR is new, or they don't know, they looked at the wrong fields. But hopefully, once we get that sorted out, you should be able to rely on the data that you're getting from CPCSSN.
But information. Yeah. I did put Rachel and the team at CPCSSN in touch with Jennifer Rayner, who's the epidemiologist for the Ontario CHCs, because she was really interested in this problem as well, and so they were going to be having a good look at how our data is entered and how that's different from how it may be entered in other models.
And it's
so they worried that they weren't actually looking in the right place, maybe.
Well, and that's one of the really advantages to getting involved right at the clinic level now is because we can get direct feedback from the clinics to say, hey, this isn't quite what we're thinking, and we can immediately improve on these algorithms. So when you look at issues like this, it could be an issue, like you're saying, of how it's being entered or where it's being entered, or it could be an issue of, hey, it's a new EMR or it's a new site, or could be a mapping, it could be technical, but it's all these things that we can work through, and we can at the clinic level really get great feedback. So I'd keep working with Rachel and Lauren, and they should be able to help you through that. Okay. Is that okay, Simone, or anything else you want to talk about?
Yes, thank you.
No problem.
Yeah.
Okay. So moving down on the dashboard, we have a visits over the last 12 months. And so in green, these are from visits by all patients. And then in what color is that? Red? Yep, thank you. Close enough, thank you. I know it's not red, but I don't know what the color of that is. So what that is showing is the visits by those patients that have one of the 9 conditions by CPCSSN. So you can see what prevalence of visits are being used, what proportion of visits are being used by those patients. And what you'll see with the DPT is the DPT is a querying tool. It's not a statistical or an analytical tool. The purpose of it is to give you a high-level picture to say, what does it look like? Allow you to ask additional questions, and then provide you a mechanism to either export to a statistical software that allow you to really drill deeper. So when you look at some of the things, I'll show you some charts throughout the way, and they're going to be just general averages. They're not going to be weighted different things. But one thing, it goes back to the purpose. The purpose is to allow you to start thinking through, what does my data look like? What additional questions do I have going from there? Okay. Then what we have on the far right over here is a condition ratio. So it shows for patients that have been in the last 12 months, 47% of them have one of the 9 conditions. But if you look across all patients, only 33% of those patients have it. So something you'd expect, those patients that have conditions, you're going to see more often, or a greater percentage of them. Okay, so that's the dashboard. What you can do now with the dashboard depends on what level you're at. So if you have a dashboard where a DPT where you're across multiple sites, you can actually filter down to each site. So I can say, well, show me just site 1. Now I can look at site 1, and there's just their data for just site 1 or site 2. So you can see different snapshots. If you're just at one site, it's going to give you the option to look at just one individual physician or provider, sorry. And so you can do a quick little snapshot to say, well, what does it look like across our different providers? How are different things going? Okay. Any questions about the dashboard? Okay.
So you're just doing all those changes through that one button at the top there?
Yep, it's just a preset filter, so you can quickly go from here. So this isn't really a searchable page. This is just your overview page, but lets you look at the different overviews of anyone that you have included in the DPT.
Okay, so question, we do have 2 sites.
Okay.
I don't know whether that would have been set up probably when we started with Citizen or no? We started with Citizen before we had 2 sites. But
Yeah, I'm thinking it's set up as one.
okay, well, we could probably talk to Lauren about changing that.
Yeah, and so what all Lauren would have to do is, if you have 2 sites and you just let them know that you want them on the same DPT, and then we'd put it into the same DPT for you. So it just has to be a conversation with Lauren.
Great.
Okay. Okay. So I'm going to go into where the power of the DPT is the search mode. So first thing with the DPT, the fields that CPCSSN use may not be the same names that you're used to in the EMR, because what we've tried to make CPCSSN to it's EMR agnostic. So we've tried to set fields that that make sense. So for example, if you're looking for a diagnosis, it's going to be called a diagnosis. But one example is health conditions. Health conditions in some EMRs is called profile, in others it's called community practice. I can't remember, but there's different names: CPP, profile, problem list. There's different names for it. What's it called in which EMR are you guys using?
Nightingale, and it's problem list.
Problem list and Nightingale. So this is your problem list and health conditions. So once you figure out the different layout areas within CPCSSN, you can correspond it to your EMR. So encounters is your schedule. Encounter diagnoses are the actual diagnoses that were made after you've seen the patient. Does that make sense?
That would be called assessment in our world.
Okay, assessment. And it's only the diagnostic codes. It's not the SOAP notes or the narratives. We don't extract those because of the sensitivity of the data, and because it's usually a block of text that's really hard to use for any searching or usage. Okay.
Yeah, we're forced to put all kinds of assessments in, so you'll get lots of assessments from us.
Perfect. So that's right.
They're in code.
Oh, good. So they're coded. Perfect. So that's your assessments will be your encounter diagnoses. Health conditions, that's your problem list. Lab results. I don't know. Is there another name for labs?
Nope.
No, that one's easy. Medications, same thing. Physical exams. Physical exams. Here are the ones that we pull. So little background for this. CPCSSN wants to pull. These are all examinations that help to define the case definitions for any one condition. So CPCSSN's looked at these as the key exams that we're extracting. There's hundreds of different other exams that can be extracted, and if there's another one that you think is really important, that would be one that you talk to Lauren about. But right now, these are kind of the exams that CPCSSN extracts.
Oh, can you back up just a sec, Dave?
Sure.
So under health conditions and encounter diagnosis, is that also only the CPCSSN ones, or can we put in other ones?
Anything is in there. So under encounters and health conditions, we extract everything.
Okay, perfect. Thank you.
Okay. And I'll show you an example. So, I'll show you one other thing. So you see there's cleaned and original diagnosis. Original diagnosis is what comes out directly from the EMR. So if I click anytime in the DPT in your search mode, if you click on the arrow, it's going to show you an example of all the different things that are in there. So if I start typing in, it'll show me, I start typing DI. Here's all the different DIs that come in from the EMR. Okay, and so that's all your different assessments. Cleaned is stuff where CPCSSN's tried to group it in. So we can know, for example, I just type DI in there. Diabetes could be in the EMR 15 different ways. So within the cleaning algorithm, it's going to try to group them into one. So when you search for diabetes mellitus, you're getting all of them. Now, a little asterisk here is cleaning mechanisms are a work in progress. So when you're doing your searches, I recommend trying searching both sides, or maybe even start with the original text, just to kind of test things out to make sure that you are getting everything, or that you're not getting false positives because the cleaning hasn't been worked through. Cleaning for the core 9 condition should be really good, but if you start looking for stuff like asthma or obesity, CPCSSN hasn't done cleaning in those ones, so I'd recommend using the original diagnosis. Make sense? Okay. Same thing, we have the codes here as well. So here's your diagnostic codes. You can search by any of those things. Okay. Let's keep rolling down here. So for where we have limited extraction are in labs and in physical exams. So for labs, here are the labs that we're currently extracting from CPCSSN. Now, it doesn't always mean that doesn't mean there's a stop to what can be extracted, because there can be extracted other things, but there has to be a really strong use case, and then working through your CPCSSN data or working through Lauren to say, hey, Lauren, can we start extracting this lab as well?
Okay, so sorry, we can't see what those are, but I imagine it's like A1 LDL and blah, blah, blah.
Oh, sorry, I didn't realize it wasn't showing up. So it's fasting glucose, glucose tolerance, HbA1c, HDL, LDL, microalbumin, total cholesterol, triglycerides, and urine albumin creatinine ratio.
Okay.
I'm just going to do something with the screen share. Tell me if it's better if oh, 1 second. I'm trying to, but it's not letting me. Okay, so I'm showing my whole screen now. Are you still able to see the DPT okay?
Yeah.
And can you see the drop down now?
Yeah, good. Okay.
There we go. Okay. Apologize, I didn't realize that I was the only one looking at it. Okay, so there's the labs that you can extract.
If you can make it take a little more of your screen, that'd be great, because it's taken up maybe about half now. Like.
Oh yeah, I have a big screen.
It's a nice wave though.
Thank you. How's that? Is that better?
Good. Fine with that.
Okay. I will warn you, it's going to flicker a couple times when I switch screens, but I'll fix it. Okay. So there's the labs that we extract. The exams, here are the exams that are extracted.
Peak low. Okay. Really? Okay. Interesting.
Oh, you're missing some that you're hoping for?
Well, we'd be much more likely to have FEV1 FVC because we have a lung health program. Yeah, peak flow is not something we record very much.
We should have that out.
Yeah.
And I'll tell you, it's ones that CPCSSN was hoping to have, but you're not alone in not recording it. I know when I was doing the stuff in Southern Alberta, rarely would there be any data in there.
So, yeah. Okay. It's something, if you looked at our data 10 years ago, we would have had it, but yeah, we don't now.
It's interesting too when you start thinking you have the hopes for, you have stuff that you hope for, and then the stuff that's actual, and it's often not the same. So, but that's what we work through slowly and surely. And I did lie. Risk factors is another one that we don't keep everything for. So risk factor, what we do for risk factors is we try to look through different areas of the chart to say, well, what do we have about alcohol, diet, exercise, stress, and smoking?
How do you get that stress one? Is it recognizing strings of letters or something? Or how do you?
So once again, this is the one that was hoped for but not actualized. So okay. If I was to search stress, you would see things of text. Sorry, go ahead.
I said, so it's there, but it doesn't work very well. Is that what you're saying?
Yep. I cannot deny or approve, or what do I say? Yes. So it may not work very well. How's that? Okay.
Says in the training, stays in the training.
Yeah, that's right. Okay. Then we have referrals, billing. All the billing data is in there. Allergies is in there. Vaccinations. It should be in there. Not sure how well. We haven't done a lot of work looking at the vaccination data. Okay. Medical procedures. So that's any of the procedures. I don't actually have any in this test database. Family history. And then the last two columns down here. Oh, did I lose someone? Or are you guys still there?
I'm there. Did we lose them?
I'm here.
Okay, I just heard a beep, so I want to make sure everyone's still around.
But I'm not hearing Somerset.
I'm not either. I'm seeing them grayed out on the.
Yeah.
Maybe we'll wait for a second here.
They may have dropped the call. I think they've been calling in via phone.
Oh.
They've been grayed out the whole time.
Oh, have they? Okay. Maybe we'll give them a second here. This approach is okay so far, you guys? You want me to speed up a bit?
I would take my cues from them.
Yeah.
It sounds like it's good, but who's the third person actually? I didn't recognize the name from Somerset. So Mary, Laura, and is the other person a data person?
I believe so, because they changed their data manager, so I don't know the new person's name.
Okay.
I think so. It sounds like he's the one who has the DPT. Oh, there we go. Are they back?
Hello, we're back.
Hey.
Welcome back.
So we better stop our conversation. We're just talking about you guys. No, just kidding.
That's why we warned you we were back. We know better.
You know better. Okay, so where did we cut out? Was it around family history?
We were just at vaccinations, and you were saying you weren't sure how well it worked.
Yeah, so vaccinations. So the ones that from vaccinations down, these are some of the newer ones that have been added within CPCSSN, but hasn't been a lot of data integrity checks or queries. So as you get a hold of the DPT, any feedback you provide is great on these ones. Okay, so that's vaccinations, medical procedures, family history. Now, the next one here is something that we did specifically for the North York Family Health Team, so it's not actually available for everyone. But what we did is we worked with the University of Victoria. They had a tool that converts ICD-9 into SNOMED. So we worked with them to convert all of the ICD-9s from the problem list into a SNOMED diagnosis. So you could then search using the SNOMED.
What's SNOMED?
Now you're asking me how is tough questions. So it's a different way. It's a more detailed.
It's a way of coding diagnoses. So yeah,
please jump in.
Different way of
ENCODE, which is probably a similar idea, right?
Yeah, exactly. Yeah.
Yep.
We wouldn't need that anyway.
Good, perfect. So I'm not even going to try to go into that. And then finally is the re-identified data. So if you had a re-identified DPT, here's where you could actually search by patient names, their date of birth, their PHN, or by provider. It just gives you more options for searching. Okay. So this is the search.
Are you going to do a demo on what you can show us on a particular client?
Yeah, I can. You want me to show you what we can, the details of one client, one patient?
If you don't mind.
Okay,
of course.
Okay, I've got one other question for you.
Sure.
There's no diagnostic imaging here, right? You've got lab results, but you don't have diagnostic imaging.
Yeah.
And one of our big issues is a lot of our lab results are living in PDFs, which means I don't think that you can get them, right?
Yeah, that's the exact reason why they're not in here. So okay. So yeah, that was the conversation. That's one within CPCSSN that's actually a constant conversation, is at what point do we start looking at tools to be able to extract PDF and data from PDF? And because we've had so many other things, it just hasn't yet materialized.
Okay, maybe for the future.
Yeah, but that's where you don't keep it quiet though. Send an email to Lauren and say, hey, this would be great. At least it's on their queue. Okay, so that's a search screen. I'm going to do a search and I can show you now the detailed, when you do a search, what you can look at detailed about a patient. So does anyone want to have a particular search you want me to try, or you just want me to do a general one?
General.
Okay, so I'm going to search for anyone between 18 and 65 that has had a visit in the last 2 years and has at least 2 of the CPCSSN conditions. Execute, find, new. Okay, so it quickly gives me back here. I'll expand it. Sorry, this is the flickering I was going to tell you about. So what you'll see here, this is one of the reasons why we're going to be switching to a web version of the DPT, so it can adjust to people's screen sizes. Right now, the FileMaker version hasn't been set up for that, so that's why some screens will be smaller than others. Okay. Okay, so you get the same graph that we saw earlier. Before I go into that, I'm going to go into an individual patient view. So if I click on view, it's now taken me to a kind of a chart review mode. So I can go one by one through the 881 patients. You can see here in the top left, it says I'm looking at 1 of 881. I can click on the arrows to click through, or I can click on this and it can take me to a random one. Just I say take me to record number 400. So I got a random. Okay. Now.
Are these our chart numbers that are exported, or how another identifier that's applied?
Yeah, That number is just an arbitrary count. So it's just saying I found 881 people and go to one. For the sake of keeping things anonymous, we don't actually have any of the chart numbers in here. You'll have a patient ID that's assigned by CPCSSN and a Sentinel ID. If you re-identify, then yeah, you could get your own. You could get you get the patient's name, your provider's name, chart number, not yet. But if that's a big requirement, we could add that to a re-identification. Okay. Okay, so I'm looking at this patient. So going across the top, we're looking at a 61-year-old female from Ontario with this postal code. This is just a test data set. We don't know anything about her ethnicity, language, occupation, housing status, education. If it was in there, we would. Currently active, they're rostered. Last time she's been in the last 6 months. I can see that by 6 months, yes. She has 2 conditions from CPCSSN. She has depression and osteoarthritis. So what I can do now, if I click on this classification breakdown, if I click on that, it's going to show me why CPCSSN has identified them as having depression. So I can see right here it's saying because she's had 1 billing of depression. So that's a pretty weak definition here, so we might want to look at it. She's only had 1 billing that's flagged her as being depressed. If I go to osteoarthritis, you can see here she has 3 health conditions or 3 problem list items. And I can see in the table to the right, right there, that she had the ICD-9 code of 715 in her health condition or in her problem list 3 times. And then all these different billing ones, and she's 7 different billings. So for any patient, you can go through and you can say, well, why did CPCSSN classify them as having this condition? And it'll give you a breakdown.
Okay, so can I ask, so you're looking back 2 years, and so when you're getting those bits of data like depression and OA and things like that, it's from that 2-year span, like something that, so the problem list stays with the patient forever. So if somebody wrote depression in the problem list 3 years ago, you're still going to see it now. Whereas if nobody ever wrote it in the problem list, I've forgotten what your name for that was.
Health condition. Yeah.
Health condition. So if it was only showing up in, say, diagnosis or whatever for 3 years ago, and then never again in the past 2 years, she's not going to show up as depression, right?
So,
like it's looking during the time interval that you're examining to find those things? That's my question.
Good question. So the CPCSSN condition identification works the same way as your problem list. So once identified, there is no kind of time span on that. So it's just say, okay, there from there. Now, if you were looking at something like that, say, well, I just want to find the patients that had a problem list item of depression in the last 2 years, that's where you'd adjust your search. So it's not going to give you the whole. So that's where you'd go here and you'd say, okay, so it's 311.
Right.
Is that the diagnostic code?
I don't know. We don't use that.
Oh, you don't use it. Okay. So, but I'm just going to cancel that search. So that's where you'd have to adjust the search. But the CPCSSN definition works the same way as the problem list. It's a non-time specific.
Cumulative, in other words.
Yeah.
Once it's there, it stays with you. Which is interesting because I know that when like ISIS looks at mental health, they like it's a rolling cohort, I think, where they dump you out after a year or 2.
Yeah.
You don't always forever, right?
Good point. And that's so I may want to hold my tongue for a second because I have forgot what the case definition specifically is. I don't know if the criteria when they're building the case definition, if there's a time span on it. But once we say that they're diabetic, it doesn't matter if you do a search for the last 6 months. If they were identified diabetic as CPCSSN, then they're still going to show diabetic.
Okay, perfect.
That makes sense? Okay. Okay, so there's the first view. So the next view we can go into is we got encounters, which is your scheduled stuff. It's going to be super busy because this is the stuff that's right on your scheduler that typically, I'm not sure how it works for your clinics, but typically it's the receptionist that's entering the data here. Okay. Encounter diagnoses, so these are your assessments. Now you're going to see a couple of things in the assessment areas. Is at the bottom, you can see something called highlighter, and there's just some overlap. I just got to shrink it for a second. And then another box called filters. And this will be throughout the DPT. In highlighter, what it'll allow you to do is, let's say you just want to highlight anything where it says hyper So it's going to allow you to quickly see where are those things for with hyper in there. Filter is going to it's going to take it a step further, and it's only going to show you those things. So I'm going to just look at hyper. So that it allows you to quickly sort through to say, well, how many times have a certain patient been assessed for any text that you want to put in. Okay. So let's dig deeper into the chart review. Here's your problem list for this patient. Then we have procedures. And so you can see the way you can tell if SIPS has spent some time cleaning is when you're doing the detailed chart review. In health conditions or in problem list, you can see that clean text is mostly populated. But when you go to procedure, the cleaned is not populated. It's because there hasn't been a lot of time yet. SIPSN hasn't spent much time working on that. Okay. Yeah, lab results. Oh, sorry, go ahead.
Oh, sorry, I was just saying those medical procedures are DIs, actually, mammogram and bone density and blah, blah, but I guess they're the specific ones that people track for incentives and health maintenance and such.
Yeah, so it depends how your EMR works. So what you could be getting is it could tell you that a bone density or a mammogram was done, but that's all you're going to get because all the information is actually held in the PDF. So your details of that mammogram or who did it, etc., is not going to be part of the database. So it may be helpful to a degree. Okay. So do you want me to keep going through these tabs, or do you want me to show you more functions? So it just kind of gives you an example of each of the areas within the DPT. Okay. Oh, here's an example of stress. So just found where the text was positive history of psychosocial stress, and then we just group it as psychosocial stress. That's pretty much all you get. Okay. Referrals, billings, and vaccine. Okay, medications. I did want to stop there for a second. There's a couple things that SIPSN does for your medications table that may or may not be in the EMR. When we extract medication, we do a couple of things. First, we code it with an ATC code. So the ATC code allows you, it's kind of a grouping of medications. Because I'm not a clinician, I don't want to totally mess up the definition of there. Are there any clinicians online, Simone? Are you a clinician?
I am. Somerset West, I'm a doctor.
No, I'm not, but Laura is.
Oh, Laura is. Okay.
Maybe Mary is. Maybe Mary's a.
No, I just played one on TV.
So ATC versus a clean, all ATC, and you can tell me if I'm off or not, but it's just a general classification of a drug. So instead of looking for one specific drug, I have to worry if it's generic or non-generic, you can just run an ATC and it's going to get a group of those medications that fit in that same kind of general classification. Make sense? Is that,
Great.
Yeah?
That makes a lot of sense.
Okay. Okay, and then
every drug has 2 names, right? Or maybe even 14 names. So
yeah.
Yeah.
So the ATC allows you to do one search it's kind of one search to rule them all. Okay. Then we tag it with the time since the medication was prescribed, and we try to break down the dose, and we also add, based on the ATC code, we give you what category it belongs to and a detailed category. So it's an inhibitor. I'm not going to try to say the words. Okay.
HMG-CoA reductase inhibitor. Yeah.
Thank you. Thank you.
How do you know those ATC codes? Is there a sort of a list of them in SIPSN, or do you go somewhere else to get them?
We have an algorithm actually that we pull them through. Yeah, and so SIPSN has a tool. We grab them through. I don't know exactly where they pull it from, but it converts the medication names to those ATC codes. So.
Oh, okay. So you just put the medication name, and it finds you the code that goes with it.
Yep.
Okay.
And so what's nice though now is in the search mode, you can search, instead of having to know the medication name, you can search by the ATC code or by category or by a detailed category. So if I go into search mode again, we're going to medications, and you'll see here's the ATC code drop down. Or I can go into category. So if I'm just looking for inhibitors, which one's ACE? There we go. I can just do it that way now instead of having to know which, or specify a bunch of different medications. Okay, so ACE inhibitors. Okay. Let's go back, cancel, details. Now I spent way more than the 15 minutes I told you I'd spend. Do you guys want me to keep going, or do you want to test some searches? There's other functions in the DPT, but this is really the core that we're looking at right now.
Well, let us think up something here that we'd like to know. Okay, and this is like, the issue is, so if I want to know who needs to be called in for a flu shot in December, it's not going to help me because I have to wait till January at the very earliest to know that, right?
Yes, because you're going to look at, I guess depends on how far back you have to look, but yeah, you're always going to have to take in consideration a 3-month delay.
Right. Okay, let's see. We've been having a lot of issues with children. Oh, this isn't children, is it?
It has children, yep.
It's got children?
Yep.
Can I see who needs or who has had a chickenpox vaccine, Verivac?
Okay, let's test it. So under what age would you like to look?
Let's say under 18.
Okay, so we're looking for 18, and then we go down to vaccines. And what was the vaccine name?
It's called Verivac, V-A-R-I. Yeah, that's all. Perfect, that's it.
That's the one, okay. Okay, so what this is going to do, it's going to show me any patient, and you want to know that they've had Verivac or have not had it?
Have not had it.
Okay, so we're going to do a couple things here. So first I'm going to do two different searches. First I'm going to get our patients that are under 18. Okay. When I do a search, it's going to ask me a couple questions. It's going to first ask me, are you looking for everyone under 18, or are you looking for people that are not under 18? And so if I'm looking for under 18, I say find. If I'm looking for the opposite, I do omit. So for right now, I'm going to do find. Then it's going to say, is this a new search or are you building on an existing search? And you're doing your Boolean. I'm doing a brand new search. Okay, new. Okay, so first thing that's got for me is, here are the patients that are under 18. Now I want to find the next set of the searches. I want to go and say, now which ones are not on this varicella. So I go new search, go down to the vaccination section.
So Dave, could we have done it like in the same screen?
We could have actually. We could have. Promise,
if you have 3 parameters. Yeah.
I'm just thinking through the logic of it, because we want to find. If we want to find all patients that are under 18, but are not on something.
Now, right?
2 steps. Yeah. Sorry. Go ahead.
And so if you put them both in, would it give you the 2 bits of logic to say find or omit to, or would it?
Yeah, it would. So when you combine them, it's an and. And so if we omit, it would, that's what I was trying to work through in my head, is if you omit both of them, then it's going to give you anyone that's not 18 and has not had.
Yeah.
So we could do it.
Yeah, and that's what we don't care about. So.
Yeah. So right now what it's done is, I think you could, but just think through. So now I have, my first subset is patients that are 18. Now I'm going to do an omit, because I want to omit anyone that has not had it. And I want to change this to a and. So I'm looking for all my patients that are, and we're going to test here. Let's see, hopefully it works. Moment of truth. Patients that are under 18 that have not had this vaccine. Drum roll. That doesn't seem right, does it? What was our patient count for under 18?
It was, I forget what it was actually.
Another reason why I guess we should have taken the thing, but let's just do a quick check now. So I can go now into view results, go into vaccines, and this person has no vaccines. Oh, so far so good. Okay.
That's pertussis influenza, not that one.
Okay, so quick spot check. It looks like it did what it needs to do. So let's do the opposite now. Let's do a search where let's search those patients that have had it. Let's just make sure it's actually working. This is kind of how you work through different queries in the DPT. This is where you can do them both on the same screen. Oh, that one, right?
Yep.
There we go. Okay, so let's just make sure.
1461 have had it.
Have had it. So now if I just where the filter is helpful.
Varicella zoster.
There we go. So it did work for us. Okay. So we had 1,400-ish that have had it and 2,400 that have not had it. And so that's kind of an example how you build that search.
Okay.
Make sense?
Cool.
And things like what you're saying, if we could do it both on the same page, that's something we can build in moving forward, different features. It's just right now it's been set up that if you're doing a find and then an omit, you do them in 2 separate pages.
Okay, seems simple enough.
Yeah.
Yeah.
Okay.
Notes, I hope.
And as I said in the demo, I know you weren't all there about, was it last week, Simone? We are working on a set of YouTube videos to kind of walk through how to use the DPT. I'll send a link to those, or do you have the link already?
No, we don't.
Okay. Right now it's
I don't think I shared it, but yeah, it was helpful. It was good. Yeah.
It was? Oh, good. Okay.
Yeah.
It's pretty slim right now. There's only about 4 videos, but I'm working on adding more over the next little bit. So you gave me an idea of how to do one now, or one video to do and how to do a find and an omit. So okay. So that's an example of a search. I want to show you the summary page because there's some things you can do here. We've seen the summary page, but
oh wait, how did you get back there?
Oh, okay. After you do so you have the view results. At the top of the page, there's that's your navigation bar in the top right. So
All right.
search all, or you click on summary. Oh, you can't see that?
Well, we can see it, but it's tiny. Yeah.
Ah, sorry. I'm going to switch back to just viewing the DPT. I think it's a little bit easier for you to see. 1 second. Is that easier for you to see from this view?
It is actually a little bit. Maybe.
Okay. Hey, you won't be able to see some of the drop downs, but I think we're okay with the drop downs now. Okay, summary view. So in the summary view, you have the overview of what's happening. However, there's some options you can do now. So there's this little I button. If you were to click on the I button, and of course you're not going to be able to see it because I just hid it from you, it's going to give you a breakdown of the criteria you've used for your search. So you can't see it right now, but it tells me I've searched for anyone with patient under 18 and the vaccine name of varicella. From there, you can actually save your searches so you can run them for future data sets. So you have one that you've run in this quarterly extraction. You don't want to forget what you did. When you get your next DPT, you can actually run that same search and see how your data has changed. To see your saved searches, you have this other reports dropdown. One of the options, and I apologize you can't see it, is something called general reports / save searches. It's going to take you to this screen. Everyone can see that screen. This is the data reports screen. Now what you'll have is your list of all of your saved searches, and you can filter by different types of saved searches because you can do saved searches by patient level or by visit level or by health condition, lots of different areas.
You could redo those over time, right? You could do it this quarter and do it next quarter and the quarter after, and it would have the same logic and the same everything in it.
Exactly.
Right?
Exactly. And you could also save it with your colleagues that also have a DPT. So you have another clinic that you know they have a DPT. You could click on one of the searches, you could export it, send it to them and say, hey, can you import this and tell me what your data looks like? So without having to actually have a direct link, you can do some comparative research. Okay. So I'm doing a quick time check. I'm okay to keep going. We're at the hour that we originally blocked. How's everyone doing? What do you want to do from here?
I have to go meet somebody else.
How much longer do you think?
I could go as long as we have, or I could stop. How's that? There's lots to do.
I have another meeting to go to, so I'm going to sign off. Thank you very much. I'll let the others, if they can stay on, and that's great.
Okay, thanks.
Thank you.
Okay, take care.
Bye, Simone.
So, I think for me, this is Mary speaking. I need to get in and just kind of play with it a little bit.
Yeah, I actually think that would probably be the best from this point because I can, like I said, I can go on and on. There's a bunch of features on here. But what I would recommend is, like you say, Mary, is start playing with it and then write down any questions you have or say, well, I'd like to do this or what's this or how do I use this? And then we can set up a second meeting, send me the questions in advance, and we can really book through the questions quickly.
Great. I'm going to sound like my very old mother when I ask this, but is there anything I can do that will mess this up?
If you can, that's a good thing, because we find out that we've missed something. So
be careful what you wish for.
So, yes, you can. There's always a way. Where there's a will, there's a way to mess something up. But really, it's not going to mess. Like it's static. It's data that's been extracted. It's not going to affect your EMR. It's not going to affect anything. So if the DPT is broken, it's just the DPT that it affects. So we're not worried about it. All that we would ask is, what did you do, so we can figure out how to fix it. So
does each site have access and a login, or does each individual have access and a login?
Depends on how you want to set it up. So when we distribute the DPT, we just send it out with one login for each site, but there is the capability to set up multiple logins. It's a behind the scenes setup, so it'd be just kind of us saying, okay, you want multiple logins, we would set them up for you in advance. And then what would happen is, as each person logs in, they'd have a temp password. After the first login, they'd have to reset their password.
Second question about saved searches. So say Mary and I are frigging around on this thing doing ridiculous searches. Are they going to get automatically saved, or do we have to actually tell it to save them?
You have to tell it to save it. So what happens is, let's say I've done a search. I'm just going to go here, and I'm in this reporting view. Okay. Now I've done this search. The DPT is like, okay, good search. Until I actually click on the I and then click save, that search is just it's temporary.
Okay. So sorry, where's save? Does save come up after you do the I?
Yeah, there's a little pop-up that comes up.
Okay, perfect.
Okay. And then, yeah, searches. Go ahead.
I did see a manual, although I've not committed it to memory yet.
Yeah.
So that would help me navigate this if I've forgotten.
Yeah, the manual is actually pretty comprehensive. So it's something that we did when we were doing the North York Fit Family Health Team setup. Almost everything is in there. There's some new features that aren't included in the manual, but it's going to walk you through really mostly everything you need to do. Do you have a copy of the manual?
Yeah.
You do, okay. So, because what I can do is, when I email you the link to the YouTube's channel, I'll also I'll email it to Danielle, or I'll just email it to the group that it was part of this video conference. Does that work?
Yeah, that'd be great, and I'll distribute it to other sites as well.
Okay.
Thank you.
But I'm open to help out, though, as we move forward. As you have questions, or if you get stuck, there's different type of questions. So if it's how to use the DPT, or how do you do this, I'm your reference point. If it's why does my data look like this, or this doesn't correspond with what my EMR, that's a Lauren question. Okay. And then if it's privacy related, you have your own contacts, but Michelle Griever is a good one to ask about what set up for privacy. But she won't be able to help you with your own individual clinic privacy, but she can tell you what they did in her clinics.
Yeah. Thank you. Great. Thank you.
Thank you. And